Sickle cell anemia, as the name says, is a chronic inherited blood disorder characterized by a quicker breakdown of red blood cells than normal. A person who gets sickle cell anemia is any person whose two parents have inherited a sickle cell gene from their parents. So if you have one parent with what we call a sickle cell gene in their body and another one also with a similar gene called an S gene, and these two had a child, there's a 25% chance that one of their children would actually have sickle cell anemia. So the most important requirement is that it is genetically inherited and the two parents must be carriers of the sickle cell gene for their child to get sickle cell anemia. But what we know roughly is how many, roughly in terms of percentage, are people who carry the gene, the sickle cell gene. If we're talking about the carrier rate in this country, the highest carrier rate of the sickle cell gene is found at the coast, around the Mijikenda group, where about 35% of the people you see walking in a village could be carrying the sickle cell gene. The next one is in Nyanza. The third one is actually in Western Kenya. Now, when you talk about sickle cell anemia, you're now going to find a larger number of people with sickle cell anemia in Nyanza first, and second in Western, and third at the coast. But we also see, because people are moving in different places, we still see the carrier status in other parts of this country. Like, for example, around Nairobi, possibly 2 to 3% of the people around Nairobi carry the sickle cell gene. But if you're looking at province per province, Nyanza and Nairobi could be the second in terms of people who have sickle cell anemia. Many countries, just like Kenya, if you're, say, for example, somewhere in Busia, your child will become anemic, and what are we going to do? Possibly transfuse you with blood without knowing what is the cause of your anemia. And that's why we need to know province per province or person per person who carries the gene. But to do that, you've got to do a national survey. And unfortunately in this country, we've not done one. But as I've mentioned, that we sit a lot in the coast, we sit around Nyanza, we sit around Western. And what are the reasons? The reason basically is that there is an association between the presence of malaria and the presence of this sickle cell gene. So where areas where you find malaria, this gene tends to be prevalent. Now, what is the basis of this? I think many people believe that when you have the sickle cell gene in a single dose, you appear to be, to a certain extent, resistant to malaria. But if you don't have the gene, or you have the gene in a double portion, the malaria tends to affect you more than those who carry the one single gene. And because it does that, we possibly lose those who are normal, and we also lose for those who have the double dose, and now the ones who are going to remain in the environment are those who carry the gene in a single dose. And that's why, if you're saying in Nyanza or in Western, and you're looking around for a husband to marry or a wife to marry, there are chances that the person you're going to marry has the sickle cell gene. And that's why we are telling people that for us possibly to reduce the presence of this gene, people in those areas where the gene is large amounts should move out of that place in order to look for either wives or husbands. What worries most, and that's the hallmark of sickle cell anemia, is painful episodes that they get in their bones. The other thing that characterizes sickle cell anemia is the anemia itself. They could be quite anemic, and there are causes of that. Either they get an infection, which can reduce the anemia, or they have a condition called a sequestration, where blood pools in one of the organs, and the common organ to pull in is the spleen. We call it the acute splenic sequestration. They can also be anemic because they are viruses, and one of them is called a parvovirus. When it enters your blood, it actually interferes with the production of blood. And it may affect you so much that if you didn't see the doctor immediately, you could lose them. Other characteristics of sickle cell anemia involve all the entire organs of the body. We can go to the eyes. Many patients with sickle cell anemia tend to be jaundiced, they have yellow eyes. And why? Because they break down their red blood cells all the time. And because of that, people worry about them. And when you ask many people, they say, my child has yellow fever because they have these yellow eyes all the time. And this is not yellow fever, because yellow fever is another infection. Sickle cell anemia can also affect the body in terms of affecting the lungs. And when it goes to the lungs, we call it the acute chest syndrome. It looks like a pneumonia, but it's a special type of pneumonia when it comes to sickle cell anemia. It's different a bit in adults, and it's a bit different in children. But it's the biggest killer when it comes to sickle cell anemia. Sickle cell anemia also go to the heart because they're having an anemia that is on all the time. If it drops further, the heart can fail. But the heart also may have a problem because of the pneumonia they have up there. The heart can again fail. But as they also, because of the anemia itself, the heart also doesn't feed very well. It is not getting enough nutrients, and therefore slowly by slowly, they have a condition called a cardiomyopathy. Sickle cell anemia will also move down and go, when it goes into the stomach, it can also give you what we call an acute abdomen, where they have a lot of pain in the abdomen, and they are crying away, and some people may think it's appendicitis. So in any African child who has what looks up like appendicitis, make sure they don't have sickle cell anemia. Within the abdomen, again, while we are still there, it will go to the liver. And around the liver there, what it does is goes to a small organ within the liver called a gallbladder, and it can cause an infection there. It can also cause stones, what we call gallstones within this small organ. It can also move down and cause what we call failure of the kidney, slowly damage the kidney progressively. And we need to make sure that we are looking at all those organs. Beyond that, as we said about the bones, it can also go to the joints. And when it goes into the joints, many people who have children with sickle cell anemia and adults with sickle cell anemia will know they may have an infection within the joints, but they can also what we just call an osteonecrosis, a destruction of the bones within the joints. When we move away from the joints, we also move down. Now let's go out of the bones and just go to the skin. Patients, especially as they get older with sickle cell anemia, will get skin damage, and they'll get ulcers, especially around the lower legs. And those ulcers don't heal. They don't heal very easily. And because of that, they may present in the hospital with that. Going up again, we may go again now because we've done the rest. Let's now move up. It can go to the eyes. And when it does go to the eyes, it causes a condition called a retinopathy. And there we can also suddenly become blind. So children and adults with sickle cell anemia must be again followed up by eye specialists, possibly once or twice a year. It can also cause a hearing problem. And that's why we say they must also be seen by ENT doctors. The other thing, and that's one of the worst complications sickle cell anemia can do, is go to the brain, where it causes a stroke. Now, what is a stroke? You suddenly feel you're weak on one side, and you suddenly possibly gradually go into a comatose state. And we could lose you in that state, or if we don't lose you, you can actually be paralyzed on one side or paralyze all the limbs. And now we know that if you find a child with that kind of condition, especially in an African setting, the chance if they had one stroke today that they have another one is high. And because of that, there are things that we're going to mention that we need to do. Now, let me also mention quickly, what else can sickle cell do? And this is one of the things that people who are listening, that in sickle cell anemia, especially in boys, remember that sometimes you can get small erections in boys. In medical terms, we call it priapism. And it can happen in bigger boys of about 19, 20, who are adolescents, who are becoming adults. And it's a condition the parents, the boys at that particular age, will not mention. But it's very important for children to be told as they grow that this can happen, so that when it happens, either the parents are informed quickly or they themselves run to a medical care center quickly, because then the complications are impotence and all the other things. The other thing that we've not mentioned that can happen in sickle cell anemia is where the person goes to play, and then when they come back, they just have a lot of pains. These may not be within the bones and long bones as we mentioned, but just the entire body. And because of that, again, as we are going to talk about the tips of surviving with sickle cell anemia, we shall see. Once you've looked at these are now what we call the complications of sickle cell anemia. But let's now mention, how do we ensure that everything is fine once your newborn or your older child is diagnosed with sickle cell anemia? The most important thing to mention for the parents is all children with sickle cell anemia must be adequately vaccinated, because the infections we see in other people who are normal are about 300 times worse off when they get a patient with sickle cell anemia. The children also must be kept on something called, now we are keeping children on something called folic acid, which is required in the production of blood. The other thing they require This is just to maintain them. They're just okay, but they're being maintained. It's a use of an antibiotic called a penicillin. This prevents them from getting some of the infection. And the common one is called a pneumococcal infection. And recently, this country brought in a vaccine to vaccinate children, especially those less than 1 year, against this bacteria called a pneumococcus bacteria. And we are saying for people with sickle cell anemia, this is quite important, even in those children who are more than 1 year. And that's why we are calling upon the government to allow people with sickle cell anemia and parents with children with sickle cell anemia to access this vaccine free of charge, even for children over 1 year. The other thing that we need to do is to tell people with sickle cell anemia, adults and parents with children with sickle cell anemia, that they tend to pass a lot of urine at any one particular time. And because of that, they must continue to drink a lot of fluids. So we're just talking about maintenance, we're not talking about anything else. Now, once you do that, the other thing that you need to do is that, as we've said, that when you play a lot, you're going to have a problem. Again, children with sickle cell anemia must not be prevented from playing, but they must play within limits. And this, the parents will know that when we go beyond that, this happens. The other thing we need to do for children with sickle cell anemia is not to wait for them to fall sick, to go to a health center. In all centers where they see sickle cell anemia, children and adults, they must have a regular follow-up, where we simply keep talking to you, checking your blood, and making sure everything is fine. Recently, there's a new drug that has come in the market, and many parents in this country have also used it, again, just to maintain them. It's called hydroxyurea. And parents who are listening with children with sickle cell anemia, and even adults, know that this drug is good. What does this drug do? 3 things. It makes sure they don't get those painful episodes quite frequently. We know that children with sickle cell anemia and adults require blood transfusion. It minimizes the transfusion, and it also minimizes the chances that they have what looks like a pneumonia that we've talked about, called acute chest syndrome. That's just to maintain. But how do you know your child has sickle cell anemia? In an African setting, the most important thing is to look out for the beginning. We will now try and look at the symptoms as the baby grows. When the babies are still smaller than than 1 year, the common thing that we see, especially in this country, the children will come in with swollen hands and feet. And this is what we refer to as the hand and foot syndrome. If you see any African child or any other child who has swollen hands and feet, crying, restless when you touch them, they don't want to touch those limbs, that is most likely sickle cell anemia until proved otherwise. And therefore, that child must be seen in the hospital. If you looked at your baby and looks restless, crying, and you think looks paler than what the child normally is in the other days, again, it's good to run, especially when you suspect that you have a background of sickle cell anemia. The other thing that makes us normally want to know what is happening is a baby who gets very severe infections. Again, newborns and even infants less than a year, when they get very severe infections, suspect this could be sickle cell anemia. And remember that even if you did a blood test and you saw the anemia, it may not have the characteristic features of a sickle cell anemia at that particular time, because of the presence of something called the fetal hemoglobin, which will then give you a picture that does not look obvious. Sickle cell anemia may also present with just excessive crying. Child cries and there's nothing much. You touch them. When you look at the limbs, they're not swollen and all that. Again, please make sure that we check this child. Ideally, what should have happened was that, as we said, we would have known whether our child had sickle cell anemia or not at the beginning if the blood had been tested at the hospital level, which we call a neonatal screen. And in this country, we think this is where we need to go, to request the government to start this test. Because why? We now think that this is long overdue. Because in other countries, like possibly in the US, they started screening babies around 1971 who were born, especially in that time, in those areas where they thought there was a possibility they could have sickle cell anemia. As the baby goes on, they may come in with joint swellings, either joints around the shoulder, joints around the knees, swollen, or around the ankle. If you see swelling of the joints and you can't explain, could be 1 or 2, again, a possibility of sickle cell anemia must be entertained. If your child wakes up one day, and possibly is less than a year, and looks sick, And when you look at the eyes, they look yellow, which we call jaundice, and you can't explain it. Not yellowness of the hands and feet, which is common in children who are having a lot of carrots and pumpkins, malenge. That is not what we are talking about. Eyes looking yellow, that kind of baby, please go and say, could my child have sickle cell anemia? The other thing that will make you suspect is you wake up one day and you see the abdomen of the baby a bit more distended than usual. And if you touch, they kind of cry, which we call an abdominal crisis. Again, it can happen at that early age. As the baby gets bigger, from possibly 2 years and above, they are walking around, they may now start getting pains that those adults with sickle cell anemia and children about possibly 10 know. That they will start off possibly with one leg, and slowly the pain migrates, it comes to the back, and it may start involving even the ribs, and when you touch them, they are crying. So the most important thing for mothers now out there is to know that when you see symptoms that you can't explain, could this be sickle cell anemia? Especially when you have a background where you had that possibly either your nephew or your cousin had sickle cell anemia, please check. But the other times when we pick them up is when you come just to the clinic, and you come into the clinic what we call a 1-year checkup, and we are telling all mothers to have their babies either tested at 6 months or a year for anemia, because we've said that this is sickle cell anemia. So if you have any anemia in a child, when you're in Bungoma, when you're in Kakamega, you're in Mombasa, please, a child who is anemic. What is anemia? Just looking pale, especially when you look at the sclera, not when you look at the hands. The hands and the feet are difficult, but you pull the eyelid of the eye, the down eyelid, and just pull it down, or look at the tongue. You're not happy. That child is anemic. This could be sickle cell anemia. But there are other causes of anemia. But those, even sickle cell anemia, we know what to do, but we worry more about sickle cell anemia. A child who wakes up one day and is not playful, you look at one side, especially those 2 years, 3 years, and one of the limbs is looking a bit weaker, is not moving, or you feel that the baby is too dull but you can't explain it, that could be sickle cell anemia, and a child of about 2-3 years getting a stroke. The other thing that you should worry you is a child who is okay, goes to school at 2.5, comes back, and then suddenly can't breathe and you can't explain it. And when the baby went in the morning, was okay. Possibly nothing else to explain why the baby is having this fast breathing. Children with sickle cell anemia, when they get this thing called acute chest syndrome, it happens suddenly and it has no warning. Again, that child could have sickle cell anemia. Then as somebody gets big, and we have actually seen children who are 7 or 8 years, they come, they are looking pale, their eyes are looking yellow, what somewhere in Migori they would call yellow fever. And the child, every time they go to school, they come back, they don't want to play with the other kids. Some people will label them weaklings and all that. These children could have sickle cell anemia. Again, this needs to be checked. A child wakes up one day and comes back and is crying, tummy is hurting. When you go to a hospital and people start talking about, especially a child of about 5 years, 4 years, this is possibly intestinal obstruction, or this could be appendicitis, au mtoto amekula chakula kibaya. In an African child, always think about a possibility of sickle cell anemia. Now, as they get bigger, it becomes